Okay. Well, we're gonna get into this. So, like I was saying, I'm gonna build a little bit on what Paul did a fantastic job last week explaining kind of the inner workings and outer workings of Medicare in general, how it came to be, and what you can look forward to. Kind of a deep dive into it, but oftentimes we don't need to do a completely deep dive when it comes to the clients. Sometimes it's simpler is better, the more straightforward. Because it can be a huge confusing topic, and with you agents we can take it a little bit deeper because you kind of need to know some of that stuff, but on the surface we need to impart that to all of our clients. So again, I have a slideshow because it's the easiest way to do this on the recording that we have here, and on Zoom, or not on Zoom, but on this Google Meet. But in the house, generally I will write all of this out on a piece of paper. And so just kind of imagine writing this out on a piece of paper. You don't have to write all the words, but you can use some symbols and things. And as I go through this, I'll show you how to do that. So I'm going to use Christina as the client. She's just coming into Medicare. So generally this presentation is going to be for people that are turning 65 that don't really know a whole lot about Medicare. They're kind of exploring, they're searching. Or it can be used for people that are already on Medicare and just never have gone through a presentation, don't know anything about Medicare at all. So you can ask them either way. Do you know anything about Medicare? What do you know about Medicare? So we'll get into it. So Christina, it's good to see you today.
You too.
Thanks for having me out. One of the first big questions that I like to ask my clients is, you've been doing a lot of research. What have you found out about Medicare?
Just that I have to be 65 for me to get it.
Yeah. That's in most cases, that is correct. So what I'd like to do with you is go through a presentation to give you an idea of what's all involved with Medicare, what is available to you, and what you need to have, and what things you can avoid, and make sure we get you in the right position. Is that fair?
Yes, thank you.
Excellent. Okay, so we'll start off with this. In 2024, we're going to start off with understanding your Medicare options. So what is Medicare? Medicare is a federal program that offers health insurance to American citizens and other eligible individuals. It's administered by the Centers for Medicare and Medicaid Services. So who is eligible for Medicare? Most people above the age of 65 that are U.S. citizens and legal residents. So now you've had to have lived in the United States for at least 5 years, and including the 5 years just before you apply for Medicare. So you have to be here for at least 5 years. So I'll stop there. The reason I put this in there is because we do have a lot of people migrating into the country. And in certain parts of the country, you're going to come across people that are going to ask for Medicare. Okay. Am I eligible? So you can remember this. You have to have lived in the United States legally for at least 5 years to get Medicare. Okay. So now back to the presentation, Jim. What are the requirements? You must be at least 65 years old or older. You can be younger than 25 with a qualifying disability. So anybody with a qualifying disability under 65 can get Medicare. And then any person at any age with a diagnosis of end-stage renal disease or ALS, Lou Gehrig's disease, can get it. Any questions about that, Christina?
No, not right now. Thank you.
Okay, perfect. So with Medicare, there's 4 different parts of Medicare. There's Part A, hospital coverage; Part B, medical coverage; Part C, Medicare Advantage; and then Part D, medication coverage. Now you'll notice that with original Medicare, Part A and Part B are under original Medicare. Then Part C and Part D are voluntary coverage. So you can choose whether to have these or not, but there's some implications to your choices on that. You have to have at least Part A and Part B to get Part C. So we'll get into that a little bit more. So what are your benefits for Part A? Part A benefits are basically your hospital benefits. So at this point, I like to draw a little little buildings on the sheet. So Part A is the building. It's the food that they give you. It's the bed that you sleep in. It's the toilet that you pee in, basically. So anything that's in that building, general nursing and miscellaneous services, and all the supplies that come with basically your room and board. Part A also covers a skilled nursing facility. So after you've been in the hospital, they may send you to rehab and send you to a skilled nursing facility. And so that covers your skilled nursing facility as well. Home health care on top of that, and then hospice care, end of life situation, it's going to cover as well. It covers blood, and then there's a few more ancillary things that it covers too. Now your benefit, go ahead.
How much of the skilled nursing does that cover for me?
Say that one more time, you broke up.
How long of skilled nursing will that cover for me?
Skilled nursing covers up to 100 days in a skilled nursing facility. Now that's if you're continuing to get better. If you stop getting better and stop, healing, they're going to take you out of that skilled nursing facility and put you over into a custodial care, which is a long-term care would be your next option. But Medicare does not pay for that custodial care. Only up to 100 days in a skilled nursing facility will Medicare cover.
Thank you.
You're welcome. Now your benefits on Part B. This includes your major medical, is what I like to say, your physicians, your nurses, or any other medical personnel. It's going to cover your emergency room, urgent care, diagnostic tests, all your ambulance transportation. That includes helicopter lift if you need it, durable medical equipment, so your walkers, your wheelchairs, your canes, things of that nature, and then much, much more are covered under Medicare Part B benefits. Any questions about that?
No, sir.
Okay. So there's two different options that you can use that we'll get into with being able to cover what's not covered under Medicare. And as we get in here, what are the costs for Medicare Part A? Your monthly premium is zero. If you have worked 40 or more quarters or 10 years, you get 40 work credits. You don't have to pay anything. And that's going to be the majority of people that you're going to come across. There are some instances where somebody hasn't worked enough and they do have to pay some, but you don't come across that, and that's maybe less than 1% of the people that you're going to talk to. What are the deductibles for this year? Now, these deductibles can move up every single year. A hospital deductible, $1,632 per benefit period. Do you know what a benefit period is, Christina?
No, can you explain it to me, please?
Absolutely. So a benefit period is a period of 60 days from when you're first admitted into the hospital. So let's say you go to the emergency room, you get admitted to the hospital, that's your first day. At the end of that 60 days, whether you've been in the hospital or not, that is your benefit period. So if you go back into the hospital during that 60 days, you don't owe $1,632 again. But day 61, you would owe $1,632 again for a new benefit period. So as it says there, beneficiaries may have multiple benefit periods that we're going to require that payment each benefit period. There's no cap on that, so it could be many, many times. Medicare Part B, your monthly premium for the year 2024 is $174.70. Now this does adjust from year to year, so it may not be the same next year. They could keep it the same, but it may not be the same next year. This also can be higher depending on your income. So if you're a high income earner, there's a tax table that tells you what you're going to pay, and we'll get into that if we need to. Your annual deductible for Part B is $240 per year. So once a year thing, $240. You have co-insurance. So Medicare pays 80%, you pay 20%. And with that 20%, it's unlimited. There's no cap on that. So let's say you have some type of cancer and you end up having a $200,000 bill, well, you're on the hook for $40,000. I'd say that's a pretty good chunk, wouldn't you, Christina?
That's a huge chunk.
Absolutely. Absolutely. So with Part B, you must sign up for Part B when you're first eligible. What do I mean by that? So a late enrollment penalty can be assessed for each full year that you're not enrolled. The penalty is 10%. So let's say you're perfectly healthy, you don't think that you need Part B, and you have 5 years that you don't get your Part B because you just don't go see a doctor. Well, then you start getting sick because you're getting older and you have to go back into the doctor, and all of a sudden all these costs, you want to go get Part B. Well, they're going to assess a penalty on that 5 years that you lost out. So you always want to encourage people to get their Part B when they're eligible for it, so they don't have that penalty. Now, the penalty does not stop for the rest of your life. The only way to get out of it is if you are on Medicaid, and Medicaid, so low income, and Medicaid will pay for that Part B. But other people, they'll have to pay that penalty for the rest of their life. So original Medicare alone has unlimited financial risk. So what do? What are your options? You have the first option is Part A, Part B, and then a Medigap plan. Have you heard about Medigap plans?
Yes, my friend has one.
Okay, perfect. Now with the Medigap plan, they don't come with a Part D prescription drug plan. So we would add a prescription drug plan to that. The second option is a Part C. And most of the Part C Advantage plans we talk about are going to come with a built-in drug coverage if you don't have something like the VA or have other ancillary drug coverage that's available to you. So most of the plans that we'll talk about, if you're interested in this side, are going to have built-in drug coverage. Does that make sense?
Yes.
Excellent.
Now my work has a drug coverage. I use them.
Your work has a drug coverage, if you can, and they'll let you stay on it after you retire.
Possibly. I was looking into that. Would they let me stay on that?
They may or may not, depending on the HR. They may or may not let you stay on that. Chances are they move you on. But if it is credible and at least up to the standard of what Medicare's drug coverage is, yeah, you could keep that. So, for instance, if you had VA coverage, the VA covers prescriptions, and so that is called credible coverage. So you would not have to get an extra Part D drug plan with your Medigap, or we could find just a regular Medicare Advantage plan without a Part D for your situation. So let's check with your HR and see what's available to you and what they're going to allow you to do on that side. Make sense?
Okay, thank you.
Well,
Yes.
okay, so let's delve into option one, the Medigap with original Medicare and a Part D prescription drug coverage. Medigap, or supplement insurance, as most people refer to it, is offered by private insurance companies. It's federal and state laws limit the policies and set standardized plans. So you're probably thinking, well, what does that mean? So all of these plans are standardized. They're all set up to do the exact same thing. So it doesn't matter what carrier that we use, they're all going to do the exact same thing. There may be some little things here or there that are different, but as far as the standard of care and the coverage, according to Medicare, they all do the same thing. There is no provider network, so you can see any doctor that accepts Medicare assignment. So you can go all across the country. So let's say you have a rare condition and you've got to go to the Mayo Clinic because that's the best doctor there. You can go there and get your care if that doctor accepts Medicare. There are no referrals in this particular program. So what do I mean by that? You're used to going to a primary care physician, correct?
Yes.
Okay. Now, with your primary care physician, Does he have to give you a referral to go see a specialist with your current work plan?
Yes, they have to. It takes a while. They have to send forms over and all that.
Sure, absolutely. So what if you had a plan that you didn't have to have referrals? You could go see any specialist that accepted Medicare. That would give you a little bit of freedom, wouldn't it?
Oh, yeah, absolutely. That'd be great.
Yeah, very good. Absolutely. So you can choose your own doctor and hospital as long as they accept Medicare. They may not have any co-payments, deductibles, or co-insurance. Now, you're just coming into 65, so the reason I put in there deductibles is anybody that has aged in before 2020, there is a plan that doesn't have deductibles, but at this point, it's no longer available to new beneficiaries. But we still keep that in there for the questions of, well, my friend doesn't have a deductible. Why do I? So in these plans, there are going to be deductibles, but generally there's no co-pays or co-insurance in most of these plans. They may offer international coverage. So the majority of these plans do offer international coverage up to $50,000 of coverage, and you'll get covered with Medicare. You'll have to pay 80%, and some of these plans will take care of that 80%. Prescription drug coverage is available under Medicare Part D. So we already talked about having to get a separate Medicare prescription drug plan. And then there is no vision, dental, or hearing. It's not covered in these plans. So it's all a la carte. Okay?
Okay.
So let's flip over to a Medicare Advantage plan. A Medicare Advantage plan, again, is administered by private insurance companies that contract with Medicare to offer coordinated care and private fee-for-service health insurance plans. So you may be familiar with HMOs and PPOs.
Yes.
Okay. And it sounds like you're in an HMO currently, correct? With having to get referrals?
Yes, sir.
Okay, excellent. So these have PPOs and then PFFSs, private fee for service. So that's another specialized type of Advantage plan. You're going to receive the same exact benefits as original Medicare. They have to do at least that, but not as the same payment rates. And so what I mean by that is you're going to have lower copays generally. You're not going to experience that 20% maximum or that 20% out of pocket right off the bat, but you're going to pay copays as you go along. But generally, those are going to be lower out of pocket copays than you would have on original Medicare. You're still going to pay your Part B premium no matter what. It doesn't matter what plan you're in, you're going to pay that Part B premium plus the premium for the plan if there's any premium at all. So a lot of these Advantage plans have a zero premium tied to them. And you're going to pay co-payments and co-insurance. Now, Christina, do you know the difference between co-payments and co-insurance?
Not a huge, I don't know a whole bunch about it. Could you explain a little bit more?
Sure. So a co-payment is a set dollar amount. Okay. A co-insurance is a percentage of that procedure. Does that make sense?
Yes.
Okay. So to go a little bit further on there, the copay is going to be when you go to the doctor, you hand them $10 for your copay. If you go to a lab, they sometimes may say, oh, well, it's going to be 20%, and you've got to pay 20% of whatever is not picked up by the insurance company.
So the co-insurance is what I'm billed.
The co-insurance would be what you're billed, and then the copay would be that set dollar amount you would just hand to the doctor when you go to make that visit.
Okay, thank you.
Mm-hmm. So Advantage plans are going to offer additional benefits such as annual physicals, vision care, medication, so your prescription, and then they're going to have some dental in there as well. Most of them also do come with a gym membership too. So there's a bunch of ancillary benefits that come with a Medicare Advantage plans. Advantage plans renew their contracts annually. That means policies are not guaranteed renewable. In the Medigap plan, they're guaranteed renewable. Once you're in, you're in. You can't lose it unless you don't pay the premium. On these ones, they're not guaranteed renewable. So your plan may change at the end of the year, and it could go away completely, and you may have to find a completely different plan. And as we discussed previously, it may include Part D coverage.
Now, can I go out of state for treatment with this plan, with the Medicare Advantage plan?
With a Medicare Advantage plan, it used to be that was very specific to a geographic location, but now with some of the growth of these Advantage plan carriers, such as United Healthcare or Humana, as long as they're in their network, you will be able to see, for the most part, you'll be able to see most of the doctors that are in their particular network. But the networks have gotten so large that generally it shouldn't be a problem. With a PPO plan, you can see doctors outside the network, so you can still go, but you're going to have a higher payment rate if you go see a doctor outside of the network.
Okay, just because we have a place in Texas that we like to go to for a couple months a year, so I just want to make sure I could use this plan if I go.
Sure, absolutely. No, that's a great question. So whenever I have clients that kind of do a snowbird type thing, I always ask them, are you going to be seeing a regular doctor down there generally, or is it mainly going to be for like urgent care or emergency services?
I just have to go see one to get my medications refilled when I'm down there.
Okay. So yeah, so that shouldn't be a problem to see that, or you can call your physician and just have them fill it in a different area for a couple of months. Or one of the other suggestions is, if it's only going to be for 3 months, just try to make sure you get maybe a 90-day supply before you leave and go down to that other area. But if you need an emergency services, even including medications, are always covered outside of your area.
What about if I went to a CVS Minute Clinic? Would that be covered?
If it's an urgent care situation, yeah. So you're not seeing a regular provider. So yeah, it would be considered under emergency services. Yep.
Thank you for explaining that.
Yeah, no problem. So option 2 is your Medicare Advantage Part C. We just went through a lot of this stuff. It's going to have provider networks. You kind of jumped the gun on that in the presentation here. It may require specialist referrals, co-pays for services. It's going to offer deductibles, vision, dental care, prescription drug coverage. Plan benefits vary by company and the county that you reside in. So these are not standardized plans. They are going to be specifically for your county. So you may have a friend that's across the country and say, well, I get this benefit, I get that benefit in this plan. That plan may not be available to you in your area. So they are very tailored and specific to your area specifically. Does that make sense?
Yes.
All right. So if we compare them side by side, Advantage plans, HMOs, PPOs, PFFSs, there are networks that we have to reside in. There are lists of doctors. There are geographical areas that you have to be aware of when you have these plans. They have a gatekeeper. The gatekeeper is in the HMO. He's your primary care physician. He has the keys to the gate to let you go see a referral or any other things that you need. Co-pays and co-insurances. There's deductibles that are involved in some of these plans. Now, this is a new one. They can have a high MOOP, maximum out of pocket. Have you ever heard that word before? MOOP?
Yes, I've heard it. I don't know much about it, though.
Okay. So the maximum out of pocket is the maximum amount that you're going to pay in any given year in any plan. So in these Advantage plans, I've seen them as low as $999 in certain areas and as high as $10,000 in other areas. But it's not a deductible. It's a maximum out of pocket. So let's say you have a really bad year and you have a $5,000 maximum out of pocket. Once you reach that limit, you have no other costs in your plan for the rest of that year. So that's a nice thing that they've done in these plans, is limit your out-of-pocket costs. These can ask actually 0 health questions. I have to change that in my slide. There are no health questions that we can ask. So I can't ask you how your health is when it comes to an Advantage plan. And most of them, again, have a drug plan built into them. Now with these, you can change them once a year. during annual enrollment period, and you get another enrollment period called open enrollment period that you can change at one time after that if you're not happy with the plan that you chose on the annual enrollment period.
So I can try
Go ahead.
if I don't get, I can switch to another plan.
Yes, during certain times of the year. So October 15th through December 7th is annual enrollment. And then January 1st through March 31st is what we call open enrollment. So annual enrollment, you can change and switch as many times as you want. But on December 7th, midnight, whatever plan you picked last is the one you're going with. And then January 1st through March 31st, you get a one-time change in an Advantage plan if you're not happy with the plan that you picked, or you find something that just significantly does you better. Okay?
Thank you.
You're welcome. So with a Medigap plan, you can see any doctor and hospital that accepts Medicare. There's no networks. You can see anybody in the whole entire nation. There's no doctor lists. You just, as long as they take Medicare, they will see you. It's a national thing. So again, you can go anywhere. There's no gatekeeper. You can go see a specialist anytime you want. There's no referrals. You don't have to see a primary care physician to get a referral, although you may want to just get an educated guess on who a good doctor may be from your primary care. You may not have to pay any copays. You may not have any coinsurance. Like I said, for that plan before 2020, you may not have a deductible, but plans nowadays, you're going to have a deductible in it. There's a low maximum out of pocket, and in a lot of these plans, there's no maximum out of pocket because you're not paying any out of pocket, really. And then you must health qualify for these plans if you're outside what's called a guaranteed enrollment period. Now, you turning 65, you have a guaranteed enrollment period. You don't have to health qualify. But let's say you go to an Advantage plan for more than a year and you want to come back over to a Medicare supplement plan, you won't be able to get back in without health qualifying into that plan. Or let's say you go through and get a Medigap plan and you're on it for 10 years and the costs are going way up, but there's another plan that's cheaper that does the same exact thing. You have to health qualify to get back over into that carrier as well. Okay, there are certain states where there's an exception to that rule, but you're living in Missouri, correct?
Yes, I'm in Missouri.
Okay, so in Missouri, you're going to have to health qualify to make any movement in that Medigap plan. Does that make sense?
Yes.
And then with that, you need to get a Part D drug plan as well.
And with the drug plan, we can find out how much my medications will cost with that.
Correct. Yeah. So one of the things that we'll do is we'll input your medications, and we'll get to that here in just a minute. And I'll show you how to do that. And so that's pretty much it. We can go through the Part D late enrollment penalty. They're going to calculate a late enrollment. So if you don't get that Part D and you don't have any credible coverage, they're going to have 1% per month is the national base beneficiary premium. So let's say $32.74 in 2020 and $33.06 is the base premium in 2021. So it's going to be 1% times the number of full uncovered months that you didn't have your Part D premium. Now, there are calculators out there that we can get on as agents to help us look that up to see how much that penalty is going to be, because you are going to come across from time to time people that don't have that Part D in place, and they're going to want to know how much it's going to cost them. Here is the earned income adjustment. So we can see this is 2024. So we can see $103,000 or less, or filing jointly, $206,000. You're going to pay the standard $174.70. Above 103 up to 129, $244, and so on and so forth. All the way up to $594 is the maximum that somebody would pay for their Part B premium every month. Now they look back 2 years. So I've had clients that have been up in this $594. And after 2 years, they don't look back anymore, and they drop back down to the regular because they're out of work. They're not making that much, and their income comes back down. So it will adjust when their income comes back down, but it's a 2-year look back on that. All right. Any questions from anybody?
I do have a question. If somebody that is new to Medicare, first enrolling, and they do have several medical conditions and potentially are probably going to be having several surgeries, would you recommend putting them on a Medigap plan as opposed to an Advantage plan because of the out-of-pocket costs and stuff like that?
Yeah, that's a great question. So generally, if somebody's going into turning 65 and coming into Medicare, and they have some major health conditions they're dealing with, a Medigap plan at that point generally would limit their costs depending on the area that they live in. So let's say in Southern California, I know they have some maximum out of pockets all the way down to, and maybe South Florida as well, all the way down to about $1,000 is the most they'll pay for the year. In a lot of instances, those plans can be cheaper than being on the Medicare supplement. But in general, for most of the rest of the country, a Medicare supplement, if they're dealing with some major issues. The other thing that the Medicare supplement does in that particular situation is it allows them to go see the doctors that they need to go to without anybody stopping them. So in the Advantage plans, there can be, like we said, those referrals, those gatekeepers. They're going to dictate what they're going to pay for, what treatments they're going to allow. On a Medicare supplement, there's none of that. Medicare pays for what Medicare pays. And there's actually a nice little app that you can get. It's called Medicare What's Covered. So if you've got a question on, hey, is this particular thing covered in Medicare, you just do a search in that, and you can know if Medicare is going to cover it or not. So that's a cool little feature as well.
Oh, how do you, just because I've had this experience before, when you're trying to explain to somebody when they do have, that they have very bad medical problems and that the supplement will be better for them, but they're seeing the premium and they're like, this one's $0, but it's ended up going to be costing them quite a bit more money because of all those out-of-pocket costs.
Right.
What's the best? How do you put it on paper and break it down and show them? Because sometimes it is harder for me to get that across. They see, oh, this is a premium here, but this one's $0. But I already know it's going to cost so much more money. And
right. Yeah. So you would break it down on paper. So essentially what you're going to do, and I'll flip over to this other screen here real quick, and I'll kind of show you how that works. Let's go here. Let's go here. 65 female. We'll get what's your zip code there in Missouri, Stina?
64086.
Say that one more time.
64086.
Okay. Now, what I did here was, this is in Medicare Center. We go to Medicare CSG app, and now I'm in Medicare CSG app, and I'm comparing Medicare supplement quotes. So you can go anywhere in the country here and get a Medicare. So this is a 65-year-old female. Now here's your price.
The screen isn't sharing.
The screen's not sharing? Oh.
No.
Let me here. Presents. There we go. See that now? Okay. So for a 65-year-old Plan G, okay, so the two plans that generally I talk about most of the time is Plan G and Plan N. So you're going to explain the Plan G and Plan N. Plan G is you pay your Medicare Part B premium. You pay the premium for the Plan G. You have a $240 deductible on Part B for this year, and then you pay nothing else after that. Okay. So to explain that to the client, so let's say we're going with Cigna here. With Cigna, it's $158.18. So we have about just a little over an $1,800 a year premium on that plan, plus your $240. So let's say round it out to $2,100 max. Okay. So that's going to be what they're going to pay each year, no matter how bad their medical is. That's what they're going to pay each year. Let's say they have a Medicare Advantage and they have a $5,000 maximum out of pocket. They could come up to that depending on what they have. They could come up to that $5,000. I asked the client, which would you rather pay if you had a really bad year? $5,000 or $2,100? And they usually pick which one?
Well, 2,100.
Exactly. So, but that's not always the case that you're going to come up to that maximum out of pocket. With that being said, I've only had a few clients throughout the years that have actually hit their maximum out of pocket. So it doesn't happen that often, but I usually put them in a Medicare supplement if they have issues, if they have health concerns, major health concerns, just for the freedom of things. Yes, over time, it's probably going to save them, but the Medicare Advantage may cost just maybe the same amount over time as well, because of the way that the co-payments and co-insurances work in that Medicare Advantage. Does that make sense?
Yeah.
Okay.
So, have you seen, like, aside from, because on the supplements I have seen, like with Botox for like migraines and stuff like that. So the supplements, I found that they are covering them, but do very many of the Advantage plans cover that? Because I can't see that when I put those in. And of course, it doesn't bring it up when I put it in the prescriptions or whatever section.
So when it comes to like Botox or things that are considered experimental, I think Botox is still considered experimental in Medicare's eyes.
With the Aetna supplement plans, they are covering it for migraines if they've had treatment with medicines for so many years before that. But I couldn't see with the Advantage plans if they're doing that for those as well.
If it's medically necessary, most likely, but I would have to do a little bit more research on that to see if that's specifically. But generally, that type of procedure is not going to come up under a Part D plan. So it's not going to be like a prescription. It's going to be administered under what we call Part B drugs. And that's something that's administered by the doctor in the office generally. And so you're going to have a different cost share on that. And that'll be in the summary of benefits of that particular plan that you would look at. But specifically carriers covering that, like you said, Aetna is doing it. So I would assume that the other carriers are doing it if they meet specific qualifications to have that procedure done.
Yeah, I just had it come up a couple times this year, and I just did get in and look at each carrier individually and then call just to verify, but I just couldn't find anything on the Advantage plans with that. So they stuck with the Medigap plans because they did cover it. We knew that for a fact. So
sure.
So I was just wondering if you knew any more about that. So
yeah. Hey, Paul, if you're sitting there, do you know anything about the Botox procedures? Maybe Paul is not there. I know he's dealing with the water damage, so he may be off doing some things. Patrika, you had a question?
Yes. I had a question. Like, what are these effective dates here on the screen? It says years in market, and then right under it says effective date. They're varying.
Yeah, okay, so effective date. So this is the effective date of this particular premium, I'm going to assume, because the premiums can adjust on these. So with this particular premium, this is the effective date of that premium. since it's gone up the last time. So you can get in this, and this is getting into a little bit deeper of a dive on this particular website with CSG. You can get in this any percentages that they've increased or decreased over the years.
Why did they get rid of the Part F for new enrollees?
That was done by the federal government. Congress passed that rule that they needed people to start paying into paying a deductible. It was just a cost-cutting mechanism for Medicare to have people be able to share that particular load, which, quite frankly, wasn't a big deal, because if you look at it with the increases in premium that the F plan was having, it made sense to buy a G plan and still pay the deductible. It was still cheaper than the F plan. So, yeah. All right, let's switch over to what I like to use. I like to use Medicare Link. So if you're here, you go to Medicare Link, and we're going to look at Advantage plans here real quick. What was your zip code again, Christina?
64086.
Let's see, stop presenting and restart this one here. Okay, so with Medicare Link, come back over here and we can do a quote. 64086.
Yeah.
And we're going to look at a Medicare plan with a prescription MAPD, Medicare Advantage prescription drug plan. Let's say you have nothing. So we're going to come down here and we're going to say, is there a particular doctor that you just have to have, you can't live without? That's what I'll ask the client.
No, not really right now.
Okay, so we'll leave that doctor empty. And then what medications are you currently taking?
Just let's see. I take a blood pressure medication. That's it right now.
Like lisinopril?
Yes.
Metformin.
That's diabetes.
Oh.
We'll put in a couple just for training purposes here. And so you can see we have multiple dosages here, 10 milligrams. And then you're taking that just once a day, right, Christina?
Yes.
Okay, perfect. You also mentioned metformin.
Yes.
No. I did. I just threw that
Right.
out there.
But for training purposes, we're going to act like Christina said it, because she's the householder. All right. So now you see that we have a most common dosage in this. So we'll just click that one for this purposes, and generally that you pick twice a day. Let's get a hard one. What's an expensive one?
Humana.
Lyrica.
Lyrica? Pick a dosage once a day. All right, so that should be enough. Is there a particular pharmacy that you like to use?
I use CVS.
Put in CVS. And are you getting any type of extra help or low-income subsidy?
No.
So you can pick focus questions. I generally don't. So we can go in here and say, out of these choices here, what's the most important to you? Let's choose 3 of them.
Frequent traveler. Insulin savings in case I have to get insulin.
Okay.
And then dental.
And dental. Okay. So now we're going to view all plans. Okay. So these plans are going to come up by our choices and by our medications. The first thing you'll notice, I want to point out to you, is the star rating right here. The star rating is essentially customer satisfaction for these particular plans. how well they're doing for their clients. The estimated annual cost, you see that there's a zero premium cost on here, but a $4,368 cost for prescriptions here. So that's pretty high, but it lists them by the most annual cost is what these are listed by. So then we would go in and we would pick and compare. Let's say we'd pick and compare the top 3 here and see what the differences are. And we can go in and compare these here, put them side by side, and then we'll just go through the list of what the comparisons are in these particular plans. And I would do this right with the client, right in front of them, so they can go through here and see which one's going to be best for them, and they can choose which one's going to be the most beneficial for them. Does that make sense?
Yeah. And do you use this compared with the medications with as opposed to using the Medigap plans with the Part D?
So you can do both. So right here with these plans, to just get to the drug cost details here real quick, there's a button up over here, drug cost details, and you can go through and see what monthly these drugs are gonna cost. You can see that the Lyrica is one that just kicks everybody's tail and is expensive. But to look for a prescription drug plan as well, we're going to go back to plans here. We're going to go up, and you can see plan type right here. We'll just flip over to Medicare Part D, and here's your prescription drug plans right here. And again, we can compare and go through the details. Make sense?
Do you ever have people to look on the with Mark Cuban's like where he's got the medications at like the pharmacy online?
Absolutely, more and more nowadays. More and more nowadays, because drugs are expensive. Now, there are things in the works from the government to cut down the cost of the maximum that people are going to spend every year. And that's going down. In fact, I think in 2025, it's going to be down to $2,000 max per year, which is going to help people tremendously.
That's the board on all plans or just with the Part D?
Yeah, that's going to be all prescription drug plans. Yep. Across the board. But yeah, for right now, I'm having people look at GoodRx. I'm having people get some of their medication through their prescription drug plan, some of it from Mark Cuban's Cost Plus or Cost Less, Cost Plus, and then some of it off of GoodRx. So you just got to play the game right now to get the lowest you can find. So.
Can you expound on that a little bit more? Of what are these options here?
As far as the Mark, what we're talking about with Mark Cuban,
right? Yes.
Okay, so Mark Cuban came up with a pharmacy company called Cost Plus, and I'm going to pop over to it. Give me 1 second here. Mark Cuban Pharmacy. Let me share this. So now he doesn't have all the medications, but he's got a lot. And so you can go in here and just look up medications. Let's put in Lyrica. He may or may not have that one. No, he does not have Lyrica because it's so expensive in general. He carries a lot of medications and really has driven down the price on a lot of these things. So it's just one avenue that you're going to use to look for medications that might be cheaper. And again, you're not going to use your prescription drug plan through this. This is going to be already cost savings to direct to the client. And then GoodRx as well. You can look at GoodRx for those cost savings as well.
Yeah, I feel my mother-in-law's last night with the GoodRx because it was $21 cheaper.
Right. Yeah. And one of the things with GoodRx is you've got to flip through the different pharmacies too, because some pharmacies, it can be much more expensive than other pharmacies. Just because somebody wants to go to Walgreens, it may not be the most cost-effective pharmacy for them to use for their medication mix and the prescription drug plan that they currently have. So that's
So
another.
it might be.
Go ahead.
So like, are there benefits of like, are there like preferred pharmacies and like standard pharmacies with the MAPD plans?
There are. Yep. Absolutely.
But even if it's preferred, some of these other options are still cheaper for them.
They can be with certain types of medications. Absolutely. So if you've come across something that is expensive, just get in the habit of looking up some other alternative avenues for this, whether it be a manufacturer's discount. Now, a lot of manufacturers don't discount people that are already on Medicare for whatever reason, but you can look at the manufacturer's discount just in case they do, and then look at, like I said, GoodRx and Cost Plus, Mark Cuban's drug company, is my two go-tos at this point. There could be others out there, but those are the ones that I've had the most success with.
Costco too. They seem to have a lot of discounts also.
Yeah, Costco would be a good one. Yep.
Okay. I love Costco.
So,
If you go back to the platform where we were looking at we were comparing the MAPD plans, like, can we look at like the what do you call it, like the contract, or like the policy?
yeah, so that's a good question. So let's go down in here. Let's go to that United Healthcare, Medicare Advantage, UHC. We're going to click on the details of that, and all the way down at the bottom. Go all the way down. You're going to be able to see the summary of benefits and the evidence of coverage. Do you guys know the difference?
Yeah. Well, yeah, I do.
Okay. Okay. So as you may know, the summary of benefits is a quick snapshot of what you're going to be paying. The evidence of coverage is your thicker book. It goes into more detail on specifics than the summary of benefits. But we can open up the summary of benefits here. And again, it doesn't share this with you. But that's where you would find that information, is down at the bottom of each of these detailed plans.
Okay.
So, and then they have it for the most part up in here, the basic overview. But if there's something specific, you would go to those plan details down at the bottom. Does that answer your question?
I usually send people the summary of benefits so they can review it too.
So with this particular program, once you enroll somebody through this platform, it automatically, if you have their email in there, it will send them a summary of benefits.
I don't have this platform. I do need to get it. I do like it. But majority I write under 65. So I mean,
yeah.
I use
so if you have one Medicare carrier, Advantage plan carrier through an integrity company, you have this platform. You are able to get onto it. The difference is right here, appointed only and not appointed. So the ones that I'm not appointed with, which are on this list, probably this one. Yeah, you can see I'm not appointed to sell with Blue KC because I just don't sell there. But the ones that I am appointed with, it will give me a little green enroll button that I can enroll through this platform if I'm appointed with them, with Integrity Marketing. So.
Just because I haven't written any Medicare in certain states, so I know with the under 65, like certain states have their own marketplace, and I can't write in those states. Is that the same with the Medicare? Do they have the same lockout where you can't, unless you're appointed with that state, like on their marketplace, or is Medicare separate from that?
No, you have to be appointed in the state that you're going to sell.
No, I meant like I have a Virginia health. I'm licensed in Virginia for health. I could write like health supplements, but like the marketplace plans, I cannot because Virginia has their own marketplace. Is it the same with their Medicare also?
No, Medicare's a national platform.
Okay.
So there's not any state-based platforms like it would be in the ACA.
Thank you.
Yeah, you're welcome. So, okay, well, that's pretty much it. Patricia, you had a question about getting these PowerPoint slides. I can get them out to you. I'm going to clean them up a little bit more, but I'll get them out to you. And by next week's presentation, I'll pin them up on the board. So, all right.
Thank you.
You are welcome. I think that should do it for everybody today. Thank you for following along. I know this is the most exciting learning in the world to everybody. It's exhilarating, Medicare, isn't it? So
You did a really good job. Thank you.
you're welcome. All right, guys. Well, have a good rest of your day. We'll close the meeting for now.